Bismillahirrahmanirrahim. Assalamu alaikum. My name is Dr. Zair Ahmed, and today's topic is for third year BDS. Um, Today we will discuss indirect retainers. Uh, First of all, after the definition or the main explanation of indirect retainers, we will be talking about why these indirect retainers are required and when do we need them, and then there are different types of indirect retainers that are provided in cast partial dentures. Starting off with the component of cast partial denture, that is indirect retainer, is um, that part that assists the direct retainer in preventing displacement of the distal extension base by functioning through lever action on the opposite side of the fulcrum line when the denture base moves away from the tissues in pure rotation around the fulcrum line. Now, this some of the key words of this definition include that the distal extension denture base and the in pure rotation around the fulcrum line. Now, we all know that distal extension denture bases are basically those dentures which we also classify as Kennedy's class 1 and class 2 dentures, and in some cases class 4 Kennedy's class dentures as well. So, fulcrum line is basically what it is an imaginary line that is that passes through the most distal abutments of the patient and around which a denture tends to rotate. Now, if we consider this as the distal or the extension on the right side, and this as the the last abutment on the left side, if we put through a straight imaginary line through these abutments, this will be called a fulcrum line, and denture will tend to rotate both towards the tissues and away from the tissues. During occlusal load, it will denture will try to move towards the tissues around this fulcrum, and when there will be any sticky food and the patient chews and then opens his or her mouth, then there will be movement away from the tissues around this fulcrum line. Moving on, this will be discussed shortly. Biomechanics. So, the concept of liver, we all know that there are three basic classes of liver. We have three basic parts of a liver, that is a fulcrum, a resistance. This is the fulcrum, this is the effort arm, and this is the resistance arm. This is the classic example of class 1 liver, in which fulcrum is placed between the load and the resistance. A class 1 liver, as we see here, is present in cases of distal extension bases with distal rests. Where rest is present, fulcrum will be present at the point of rest, and this will be the effort arm, and this will be the resistance arm. This is the class 2 and class 3 levers. So, moving today, the most important lever that we will be discussing will be the class 1 lever. So, moving on to the rationale of indirect retention. Basically, if in distal extension there is a tendency for the prosthesis to rotate around the fulcrum line in function, because there is no beyond the edentulous space, or we can say the saddle area, there is no distal abutment, so the denture tends to rotate. So there is a need to resist this rotational forces by providing indirect retention through the indirect retainers. Excuse me. This is a typical example of class 1 lever with the fulcrum at the rest, the effort arm on the distal aspect of the distal extension area, and the resistance in the. Here we can see that uh, this is the movement that is the away from the tissues. This is the movement during occlusal loading, that is towards the tissues. Now we can see that this movement, this movement towards the tissues can sometimes be resisted with the help of occlusal rest. Now here we can see that this movement is unsupported. This movement will go unnoticed. So there is the direction, or the, you can say, the provision of indirect retainer in this area, which will act in by resisting the movements that are away from the tissues. Now this is the main function of the indirect retainer, but together with this function there are some auxiliary functions of indirect retainers. It also activates the direct retainer to prevent the movement of the distal extension base away from the tissues. This is the basic function of the indirect retention. Otherwise, it also reduces the anterior-posterior tilting leverage on the abutments as well. And also, contact of its minor connector with the axial tooth surface helps in providing stabilization against horizontal movement of the prosthesis. This picture has been already discussed. Also, the interior teeth that are supporting indirect retainers are stabilized against lingual movement as well. Also, they act as auxiliary rest to support portion of the major connector, facilitating the stress distribution. It also helps in accurate repositioning of the prosthesis during relining or rebasing, and it aids in additional support and stability of the prosthesis. Here we can see that whenever there will be movement away from the tissues, these major connector, it will try to seat over the hard tissue and it will resist this movement which is away from the tissues of the distal extension bases. This is the major basic concept of indirect retention. Now there are some certain factors that have to be kept in mind when we give indirect retainers according to their design, their location. Basically the most important part is the location where we have to put the indirect retainers. Number one is seating of occlusal rests in movement. Occlusal rests must be kept in their seats by the retentive arm, because if they remain in their seats, then the rotation around the axis will occur, which will activate the indirect retainer. In other words, we can say that direct retainer has to be most efficient for the indirect retainer to be effective. So the occlusal rest, which will be providing a fulcrum, has to have been properly seated against the hard tissue surface for the indirect retainer to be activated. Also, the distance from the fulcrum line, or the location that we were talking about, the location of the indirect retainer is the fulcrum line which is present in the distal abutment, the indirect retainer should be positioned as far away from the fulcrum line as possible. Greater the distance between fulcrum line and the indirect retainer, more effective the indirect retainer will work. Indirect retainer must always be placed perpendicular to the fulcrum line, and it should be located as far as possible from the fulcrum line. So this is the fulcrum, this is the effort arm. We know that the longer the resistance arm, more effort will be required to uh, to overcome this resistance arm and move the dentures. So more distance, more effort will be required. Otherwise, more amount of force will be required to lift the denture. Here we can see that this is Kennedy's class 1, and this is the imaginary fulcrum line which is passing through distal extension, this last standing abutments and their occlusal rests. And this is the ideal position of the most ideal would be most away, which is the incisors. But incisors, there are they are very difficult to cope with indirect retainers. So the most you can say the most ideal teeth that are considered for indirect retention are the first premolars or the canines. Here we can also see that this also shows that the perpendicular, we have to have the away from the fulcrum line in the perpendicular fashion. Location of the fulcrum line, look, uh, location of the fulcrum line should be as far away from the indirect retainer as possible. Rigidity, we know that in as in the case of major connector, rigidity is most important for the direct retainer and for the indirect retainer to be activated. Effectiveness of supporting tooth surface. Supporting tooth surface means that the surface over which the indirect retainer has been given. Effectiveness only can only be achieved by proper rest, proper formation, proper mouth preparation of the area over which the indirect retainer has to be given. It should be placed on definite rest seat so that they transmit forces along the long axis of the tooth. Now, there are different forms of indirect retainers that can be given in the cast partial denture. The first and the most common is the auxiliary occlusal rest. Occlusal rest without any provision of retentive arm and reciprocal arm. Only the occlusal rest portion of the direct retainer is provided on the abutment tooth, which acts as a indirect retainer. Other we will discuss one by one. The auxiliary occlusal rest is located on occlusal surface and is as far away from distal extension as possible. Most commonly, it is present on the occlusal surface of first premolars, because the beyond the first premolars there will be canines, and on the canines the rest will be called the canine rest, and the or it will be called cingulum rest or the incisal rest, not the occlusal rest. Occlusal rest would only be present on the posterior teeth and their occlusal surfaces. The ideal location of indirect retainer perpendicular to the fulcrum line would be in the vicinity of central incisors. But the central incisors, the proper formation of incisal rest or cingulum rest is very difficult because of the shape of the teeth. So we have to make a compromise and give it on the most far away posterior teeth, which are first premolars. This has been already discussed. Here we can see that this is the Kennedy's class 2 modification 1. This is the most distal abutment. This is the most distal abutment. The fulcrum line is passing, and when we draw a line which is perpendicular to this, it falls in the areas of lateral or central incisors. But because of their shape and difficult mouth preparation, we must compromise and give the indirect retainer in this area, which is occlusal surface, the mesial surface of mesio-occlusal surface of first premolar or the cingulum rest of the canine. Here we can see that this is the ideal position in which this is the fulcrum line, and when we draw the perpendicular, it falls on this first premolar areas. Okay, this has been discussed. Now this is the Kennedy's class 4 and this is the fulcrum line. and the most away from the this because there is no, when we draw a perpendicular line from this we get nowhere, so we see teeth which are most away from the fulcrum line, which are the last standing molars, and we give it, because occlusal giving occlusal rest on the molars are easiest, and it can be given on all these molars as well as these molars as well, so we choose the abutments which are most away from the fulcrum line. This is also a Kennedy's class 4 denture in which the indirect retainer is provided in the last standing molar. Canine rest can also be given when the first premolar is too close to the fulcrum line and it is placed on the cingulum of the canine. And it becomes more effective if the minor connector is placed in the embrasure space between anterior to the canine and arcs backward into the lingual rest seat. Excuse me. This is the cingulum rest over the canine. You can see that the provision of rest for indirect retention should have definite seating. This is the basic requirement for the indirect retainer to be effective. Canine extensions from this is also we will discuss later. These are the basically the major connector which also act as together as indirect retainer, and also it has terminal rests as well. It will give the indirect retention to the area. This picture has already been discussed before. So the lingual plate, which is the major connector, it also can provide indirect retention. It provides excellent indirect retention, and it is seen only when it is supported with rest on both ends. Lingoplate, if it is provided without any preparation on the abutment teeth, then it will not act as indirect retainer. It will only act as indirect retainer when it has supporting occlusal rest on its terminus. Here you can see that although it is a major connector, but to support this major connector and to retain its place over the lingual surfaces of teeth, these occlusal rests have been given. These occlusal rests in essence will be providing the indirect retention in this case. Here we can see the provision of, this is the fulcrum line and this is the provision of indirect retainer. Modification areas can sometimes also present as indirect retainers, mostly in cases of class 2 modification ones, and the secondary abutment is used for indirect retention, like in this case in which this is class 2 free and saddle hai. No, it is class 1, sorry. Both are the free and saddles, and the modification area, this tooth is missing. So if in provision of this area, this area will already act as indirect retainer because it is away from the fulcrum line and it provides all the necessary requirements of the indirect retainers. Ruga area can also give necessary support required for indirect retention. Only in horseshoe design where prosthesis retention is not sufficient. So this concludes the topic of indirect retention. Next will be inshallah the denture based considerations. Thank you very much.